we'll move to the next discussion, and we have actually spoken a lot about aortic insufficiency. So aortic insufficiency simply means the aortic valve is regurgitating. That's blood what enters into the aortic valve and it can fall back, it regurgitates, So here we're not trying to talk about the condition, but we're actually trying to talk about the treatment. So what's the treatment for aortic insufficiency? So aortic insufficiency, also known as aortic regurgitation, is treated based on how severe it is, what are the symptoms, and what actually caused the issue. Okay, so for medical management, sometimes if the condition, the symptoms are not really much, you might just want to observe and monitor. Okay, so regular echocardiograms just to track how the valve is getting large, to track how the heart is doing and all of that. You keep monitoring the symptoms of the patient, like shortness of breath, chest pains, or fatigue. Then you can actually bring in medications like vasodilators, like all those angiotensin converting enzyme inhibitors. Okay, nifedipine. You bring in diuretics because most of the times there's accumulation of fluid in the body, so you want those diuretics to put those fluids out. Okay, then what's up, Christian? All right, they use beta blockers, and all of that. Then you can also use antibiotics, right? So you are using antibiotics because you want to actually not prevent. Okay, most of the times aortic insufficiency, that's issues to the aortic valve, are caused by infections, caused by bacteria. Okay, so surgical intervention include all those aortic valve replacement. If the valve is damaged too much, you might actually want to do a surgery to replace it. Okay, then if the valve is something that you can manage, you do a valve repair. So transcatheter aortic valve replacement, that one is a minimal invasive surgery. Then if the aortic root is affected, you also have a surgery known as the aortic root surgery. Okay, so those are the various treatment